Welcome back, everyone. You know, cancer affects all of us, but for Black women, the risks of breast cancer can be even higher. The American Cancer Society is now conducting a study. It's called Voices of Black Women to better understand disparities in healthcare. I'm joined by Houston Ambassador Shamika Dukes. Thank you so much for being with us.
Thank you for having me.
Appreciate it. Okay, so first of all, can you share why this research is personal? What made you become an ambassador?
Sure. So within my family in general, the women, various ages, have had diagnosis of breast cancer. As you know, when we look at items like breast cancer, there's a lot of fear, but prevention is key. With my family, we have had successes, of course, with women who have beat the odds, but unfortunately we've had some losses. So when I think about Voice of Black Women and what it means, I think about our future generation, my nieces, my cousins, and so that's where the focus is for me.
Okay, incredible. And it is important to mention that Black women are disproportionately impacted by breast cancer. I know it's not an easy answer to tell me why this is the case, but walk me through a couple of the different factors here.
Sure. Well, Black women have the highest death rates as well as the shortest survival rates of all cancers in the U.S. And when we look at Black women under 40, we have the highest breast cancer rates.
Okay.
And that alone is enough within this study for us to start looking at how we can contribute to the conversation.
Yes, okay, because there's many factors that impact this. Some of it's genetics, some of it is access to health care.
Absolutely.
Right? And some of it is that early detection that we talk about. So what are the goals of this study? How can you influence that conversation?
Thank you for that. So this study is led by the American Cancer Society, and it is about understanding and improving the health of Black women. We are looking for 100,000 Black women in the U.S. or District of Columbia who have never had a cancer diagnosis, with the exception of some skin cancers.
Okay.
Ages 25 to 55 years old. One of the things that is critical with this study is understanding that it is not an in-facility medical observation, no tests, no drugs. This is about an online study that is done once a year, or the first study, excuse me, is an hour long, and twice a year after that, you take a study, you participate in a survey, and it is 30 minutes long on the follow-up surveys.
How do they get in touch with the organization to start this process?
Absolutely. So that would be voices.cancer.org.
Okay, super easy to do. I have to say, I have a lot of breast cancer in my family. I'm in case studies, and it's super easy. I mean, again, a lot of this is just surveys. What you're wanting is a big picture of lots of women over the course of time.
Absolutely. And we're talking not just medical items in this survey, but social, economic, environmental.
Let's really try to understand what's happening here. So if you're watching this right now and you're thinking, I don't know, is there a big benefit for me? And you know, maybe I should, maybe I shouldn't. What's your message?
Think about the future. The numbers are scary, but they are our reality.
Yeah.
If you think about where we are and being able to contribute to the conversation, being able to contribute to the research, this is it.
Yep.
The generations to come is where we can impact this now.
Yeah, so well said. Shamika, thank you for joining us and coming in today.
Thank you.
We so appreciate it. It's easy to do, and really you can help to change the course of the future for so many other women. We're going to head over to Kim.